My name is Steven. I'm in Team 4 with Braden and Allison, and our group had the negatives of cochlear implantation in children. Our group's topic was whether or not children should or should not be implanted with cochlear implants, and we believe that children should not be implanted with cochlear implants due to the surgical risks, total cost of the implant and outpatient care required, adjustment period after implantation, and the cultural damage that may be done to the child and the deaf community because of the implantation. The procedure itself is a small incision that is made behind the ear, and a hole has to be drilled through the mastoid bone in order to gain access to the cochlea. An incision must be made inside the cochlea so the two internal devices can be implanted, one on either side. An external device will then be secured behind the ear on either side, and any loss of all residual hearing will occur. The results of this procedure vary pretty heavily between person and person and when the age the individual was implanted. There are many risks and complications with the surgery. Mainly, infection of the brain, head, and spinal cord can occur and cause permanent lifelong damage. Surgery can cause damage to the cranial nerve located near the cochlea, which is a surgery site which can cause facial paralysis, lifelong dizziness, vertigo, disturbances to taste, and pain. These devices can also malfunction from time to time based on external conditions or just internal failure, and require updates that will require the child to undergo the surgery again to fix the implant or update it. Every time the child must undergo the surgery, they are once again exposing themselves to the risk of complications such as the infection and paralysis of the face.
The total cost for the surgery may vary from $50,000 to $100,000. The surgery itself may or may not be covered by insurance if some residual hearing is present. Many expensive MRIs and other scans must be performed prior to the surgery to ensure the surgery is possible and can help. Patient will also need to pay for the night spent in the hospital following the surgery. A speech therapist is often needed after surgery to help adapt to spoken English and the sound that is conveyed through the implant. Adapting to the new implant. Many children and parents report there is a large adjustment period after the procedure where the child must learn or relearn spoken English. The sound the implants produce are not what a hearing person would perceive. They are more electronic than normal and require someone to relearn different sounds. Often requires intense rehabilitation to relearn speech with tutors and audiologists that may require more money and resources that families can't afford and insurance won't cover. Cultural consequences. Many in the deaf community view cochlear implants as a threat to the deaf community. Those who are implanted often speak only spoken English and never learn ASL and transition more towards the hearing world than the deaf one. Deafness is often framed in the medical world as something that should be fixed and push implants like a cure for deafness and ignoring the rich culture the deaf community shares. The decision is often made, especially by hearing parents with deaf children, to implant their children when they are young and without consent. This removes a choice for the child and often makes immersing themselves into deaf culture difficult. Also concerns over growing numbers of deaf children who are implanted, decrease the numbers of those who participate in deaf culture, weaken and hurt the culture as a whole.
To make their own decisions about whether they want to receive a cochlear implant or not, since once they make the decision, the change is irreversible. Deaf children could also grow up not wanting to get the cochlear implant and remain deaf. The refusal of children and their opinions are important and should be taken into consideration when making the final decision. The child should be asked at an appropriate age when they know how to decide on something and fully understand the procedure and what comes with it, its pros and cons, as we've discussed. This is our works cited page. And thank you for listening to us about why we believe children should not be implanted with cochlear implants.